First of all, on behalf of QP, I'd like to thank Natalie Mera and all of the community organizations and local health coalitions and all of the unions that are the Ontario Health Coalition. I don't know what we would do without the Ontario Health Coalition. We're in for a very serious fight, and this organization and our unity and our solidarity and militancy in defending a public health care system gives me hope, gives our members hope. It's what we need to move forward in these challenging times. Sid Ryan would say that was tundrous applause, tundrous. Meaning you could barely hear it. First of all, just a few points about Ontario's healthcare system. First of all, obviously Ontario hospitals are the single largest area of government spending, and we have a government that's committed to cut $15 billion in deficits. We could talk about whether that's a real deficit or not, but in addition, another $7.5 billion in corporate and personal tax cuts by years 3 or 4 of their mandate. And with hospitals being such a large area, it's impossible to make cuts of that magnitude on expenditures and revenue without attacking hospital funding. And in fact, we're predicting that the government would have to close between 2,400 and 3,700 acute care hospital beds, seasonal permanent bed spaces to accomplish that kind of reduction, and they would have to eliminate between 8,500 and 16,000 permanent staff positions in the hospitals to do that. And this would happen to a system which is already an outlier in terms of not only Canada, but the developed world. In Ontario, we have 2.1 beds per thousand, in Canada 2.7, and in the OECD, in a place like Britain or France, 4.7 beds per thousand. If we were at the average of the rest of the country, we'd have 35,000 more hospital beds in this province. And we'd have hospitals still in Fort Erie, in Port Colborne, and in all the other communities where they've been shut down. The other thing that we need to bear in mind is that this hospital system is straining already under the weight of a growing and aging population. And those pressures don't diminish, they aggravate over the next 25 years. And then they decline. But for the next 25 years, Ontario's population increases by 30%, the number of seniors doubles, but most concerningly, the number of plus 70s triples, and the number of plus 90s quadruples. And these are the age cohorts which are going to come to the hospital for the first time. And with the Health Coalition, we'll be launching a human rights complaint this spring alleging that there is age discrimination and rationing that goes on already with respect to seniors and the elderly in the provision of acute hospital care in the province of Ontario. Our mothers and fathers, our aunts and uncles are the people who are turned away, who can't get in, who languish on stretchers outside of ERs, who live in broom closets, who die there with no privacy, with no dignity. That's what life is like in the hospitals, operating at over 100% in a province which refuses to pay their real costs and meet their social obligations in a system of socialized medicine. That's the challenge that we face. And what are we going to do about it? What gave me such hope at our last rally was to see so many people come from so far, and so many people working so hard to dig deep and mobilize in our communities, because that's where the battle will be fought. The battle will be fought in West Lincoln. The battle will be fought on Manitoulin. That's where the battle will be fought, in Sudbury. But we also need hope to continue that battle, and we get the hope by seeing our numbers grow. We see the strength that we get from the commitments we make to to each other that are honored as unions and social movements deliver increasing numbers of people to stand up to this government and say, we demand the kind of funding. We've had real cuts in hospital funding since 1991. 1991, there's been no real growth. They've lost almost half their budgets in that time. We're here today to stand up for those hospitals, to stand up for the people who need them, to stand up for a real increase in funding, a real increase in long-term care, for publicly delivered home care. We're here for quality care, and that's what we're all about. And working together in the support of this action plan will make that happen. And we will push this government back, just like we pushed the other governments back, the thought that they could transfer wealth to corporations and the wealthy at the expense of the people who need care in the province of Ontario.